Hello, my name's Adrian Richards. I'm a consultant plastic surgeon and I'm the surgical director of Aurora Clinics, which is a company based in the UK. So what I'm going to talk about today is recovery from gynecomastia surgery. In previous videos I've talked about the causes of gynecomastia and the different surgical options for it. Today I'm going to talk about the actual process. So normally what we'd like to do is meet you during pre-operative consultation, really go through what's involved with you, discuss the options, show you some photos, give you lots of information about the procedure. Then if you had the procedure is performed normally under a general anaesthetic. Liposuction can be performed under sedation, twilight anaesthesia if you'd like, but normally under a light general anaesthetic. Find it more comfortable for everyone. And normally with a one-night stay in hospital, although some people like to go home that night. So you can go home that night or you can stay the next day. The operation liposuction takes about an hour and a half. Excisional techniques take a bit longer, sort of 2.5 hours. And then you wake up nice and gently. Very important with any cosmetic operations to wake up very slowly. And again, very important, I work very closely with an anaesthetist who is very good at reducing nausea and sickness. So really you should feel fine straight after the operation, normally like you eating and drinking and mobilising straight away, so that's up and about. Okay, now it's very important with this form of surgery that we get good compression on the area to limit swelling, because after any operation, liposuction and cutting operations, you will get swelling. The body basically brings water to the area which causes swelling. So we can reduce that with compression. So we fit you with a compression garment, which is almost like a vest with a zip up the front, which compresses the front of the area. Okay, and we'd like you to wear that probably for a minimum really of 3 weeks, because it speeds up the resolution of the swelling, gives you a much flatter, better result earlier. Okay, bruising can occur, and what we would encourage you to massage the bruised areas either with arnica cream or a special cream we've got in the clinic, which is based on vitamin K called Aurora. Swelling and particularly bruising are very variable. You may be bruised more one side than the other, you may be more swollen one side than the other. That's relatively normal. We like the compression garment on. If it's liposuction, the incisions, studies have shown that the incisions actually heal better when left to sort of contract on their own rather than being stitched, because when they're stitched, often you can get those sort of stitch marks either side of it, where the entry sites are. So we leave those to heal on their own, normally heal like little sort of red marks, like a little mole. Scars around the nipple need to be very careful with. We like to support those with tape, and the reason for that is the tape sort of splints the incision, so there's no tension pulling the skin apart, because if there's tension on a wound, the body's reaction is to make more scarring. So if the body sort of feels that the scar's being pulled apart, it heaps up more scarring, makes a lumpier scar, so tape really helps. When you're going to see the effect, well, you see the effect pretty much straight away. You will have some swelling, but it's going to take really 2 to 3 months. It's quite a long time for all the swelling to go down, all the scarring to go down. The scarring continues to improve over years. The body's constantly remodelling scars and making them flatter and paler. So you'll notice a difference straight away, but really for the full effect you need to wait, as I said, 2 to 3 months, and it's going to continue getting better following that. Question I'm asked is, following gynecomastia surgery, if I put on weight, will it come back? And the answer is no, not normally. The reason is we've removed most of the fat cells, and with time, when you put on weight, you don't get more fat cells. The fat cells you've got just swell. Okay, so if we remove 2/3 of the fat cells, there's only 1/3 of the fat cells left to swell up. So you won't tend to put weight on there, you tend to put it on other places. So I hope that's been informative. If you would like any more information about gynecomastia or any types of surgery, please contact us either via email or contacting us via the Aurora Clinics website, which is aurora-clinics.uk, or just phone us up on the UK number 01844 214 362, and one of our surgeons would be happy to discuss any aspect of this form of surgery with you. So thank you very much for listening to and watching the video. We hope to see you soon.